My name's Rece, and I'm going to be your student nurse today. I'm going to do the postpartum assessment on you, if that's all right with you. So to get started, can I have your name and date of birth? Check. All right, great. So to get started on this, I'm going to check your vitals first. So I'm going to get your temperature real quick. However, you just place this underneath your tongue back by your molars, that'd be great. Alright. Next, I'm going to get your pulse, and while I'm doing that, I'm also going to check your respirations as well. Okay, and then I'm going to get your blood pressure as well, so I'm going to drop this down real quick. It's fine if you use your left arm. Just rest that there. So, my last vital sign real quick, I'm going to check is your pain. On a scale of 1 to 10, 1 being not so bad, and 10 being the worst pain you've ever had, how would you rate your pain right now? That's not bad at all. That's pretty low, so that's good. So to continue on, I'm going to listen to your heart, lungs, and then I will listen to your abdomen as well, your stomach, your bowel sounds. So just breathe regularly for me here. Okay, take some deep breaths. Now I'm going to roll your gown up a little bit just so I can listen to your abdomen, if that's all right with you. All right, good. Do you know when the last time you had a bowel movement was? Okay, not too long ago. And then, I'm assuming you're passing gas as well? Yes, okay. And then for your bladder, do you know when the last time you voided was? Okay, same time, okay. And then, do you have any difficulty urinating or any pain while doing so? No, okay. All right. And if you did, that'd just be a potential sign of UTI or something like that, so. That's good, you do not. So moving on, I'm going to look at your breast. Do you have any pain, redness, warmth, any tenderness, or if it feels hard to you? Okay, no. So I'm going to take a look myself. Good. Okay, soft, no warmth or redness. I don't notice any cuts or anything, so the nipples are intact. No warmth, redness, or anything, so that is good. Moving on, I'm going to put some gloves on, and I'm going to feel your fundus, which is the top of your uterus. So I'm gonna grab some gloves. All right. So now I'm just going to leave my one hand here. I'm going to feel your fundus. Okay, good. It's firm. It is midline with the umbilicus, and it is approximately 1 centimeter above the umbilicus. So you do want your fundus to be firm. This is what helps stop hemorrhaging and bleeding after during postpartum. So that is good. Okay, so next I'm going to, well, and if it did get soft, you could just take your hand and just massage it like that in circles for 1 minute, and that will tighten it up and make it constrict, and it will become more firm. That's just something to help if you can feel that it's not firm, and you could, if you do have like further bleeding or anything. So now I'm going to check your lochia. I'm going to check your pad, see how saturated it is. Do you know when the last time you changed your pad was? Okay, an hour ago. All right. Okay, I would say it's 1/4 saturated. It is red. There is no foul odor, and I did not see any clots. So with that, like a foul odor, that could possibly be like an infection in your uterus, so that is not good. So if you do smell something that is irregular with that, then you should get a hold of a nurse or doctor, and they can take a look at it for you. Also, there was no clots, so that's good. Usually something to get worried about would be a clot the size of like a golf ball down there. If you notice that, then once again, get a hold of a doctor, a nurse, or something. And if you do saturate it completely within 1 hour, that is hemorrhaging, you need to get a hold of a doctor as soon as possible for that. Okay, so now I'm going to check your legs for DVTs, if that is all right with you. Okay, first, do you have any pain in the calves? Either calf? No, all right. All right, so there's no swelling in either legs. There's no warmth or redness as well, so that is good. All right, now I'm going to actually flip you over to that side facing the other railing, and then I'm going to check your perineal area for hemorrhaging, your pediostomy, and then you also want to check your epidural as well, if that's okay with you. All right, so just bear with me here. If you can help me, that'd be great. On the count of 3, I'm going to flip you over, all right? 1, 2, 3. All right. There is no redness, ecmosis, edema, or drainage. It is slightly approximated though, so that is good. You can tell it's getting better. There looks like there's no irritation either. I do not see any hemorrhoids, so that is good. And your epidural as well. It looks good, it's intact. There's, like I said, there's no redness, ecmosis, edema, drainage, or anything around it, so that is good. Let me cover you up now. Now, if you were to have had a C-section, I would assess your abdomen, and if there's a dressing on there, I wouldn't take it off. I would leave it on, and I would look for if there's any drainage coming out of it, and if there was, I would draw around it. So I'd come back later and check it again, see if if it's got worse, and I'd also know the color of the drainage or whatever. And then, now if there was no dressing on it, I would look at the incision and check if there's any redness, ecmosis, ecmosis, edema, drainage, and the approximations of it, of this sutures and how that's going. Also with a C-section, usually the mothers have a Foley catheter in, so I would ask the patient if they have any pain down there, and then I would do catheter care, but usually after a little bit they try to get the mothers off the Foleys as soon as possible. I would assess if I could pull that, so it would limit the risk of having a UTI caused by a catheter. And then lastly, I would check the IV site in the hand. I would look, obviously there's good filtration going through still. I would check the IV fluid bags, and then I would also look at the site as well for any redness, if there's any swelling, for swelling in the arm, or anything in the temperature of it. So if it's warm or if it's cool, then that could give us signs of some IV problems as well. So.